Welcome to The Human Element. Today I am joined by Colette Brown. Colette is the CHRO at Stony Brook University Hospital, which is one of New York's leading academic medical centers. Colette leads HR across a very complex but also mission driven organization where culture, workforce, and strategy, as well as emerging technology, all have to work in harmony in service of patients and people. So this is going to be a fun one. Thank you so much for coming on the show, Colette.
Thanks for having me, Barb. It's my pleasure.
Well, let's start before we dig into the big stuff. Take me back to what is something that working in HR at a hospital that you didn't expect before you started working in healthcare?
Yeah, great question. I guess I really didn't fully appreciate that healthcare professionals not only care for their patients, but they really care about them too. So they get emotionally invested in the patient and their families. And when, for example, they experience a loss like a preemie who doesn't make it, they literally carry some of that emotional weight with them. So in HR, no matter the industry, we're here to support our people. But in healthcare, we are literally caring for the caregivers. Knowing all that our employees carry makes us even more committed to doing our very best for them.
Oh, completely. How does that change some of how your team operates in order to be that caring and empathetic support mechanism to the team members and the caregivers within your environment?
I'm not sure that it really changes the approach as much as it, I would say, reinforces it. So the way I lead HR and what I ask of my team is really to treat every employee like the most important person in the room. So when somebody comes to us, whether they're needing benefits information or guidance on a leave of absence, or they're having a difficult situation, they really deserve our very best. And that's the standard, regardless of where you work. But in healthcare, I think when you understand the emotional toll of the work and how high the stakes are for our employees, it just deepens that commitment to that standard. So we're not just providing a service, we're literally taking care of the people who are taking care of everybody else.
Completely. And that is really, I mean, a level of empathy that we would probably all like to ensure that our teams are thinking about. I like how you framed it, treating every employee like they are the most important person. And wouldn't everyone love to be treated like that, regardless of where you work, in a conversation with a partner, a colleague, a stakeholder, right, that you're working with? I would love to see if there's a lesson in how your team is working that you think those outside of your industry or outside of your team could borrow, in terms of something they could borrow from how you think about the workforce or what your team is doing that maybe one of our listeners could use with their own teams this week.
We just always try to bring everything back to the mission. And even in HR, where we're fairly removed from the patient, we just try to always center it around that mission. So when I talk with my team and when we have our HR huddles and certainly throughout COVID and since then, we talk a lot about how the work we do ties back to that patient. So I think patient care and patient experience is a mission everybody feels emotionally connected to. We've all either been a patient, had a family member who's a patient, worried about somebody who's been sick. So I think each of us can really connect on a deep emotional level to that mission. And we tie it back to that. We say, okay, we are finding the best people, recruiting the best talent, recruiting people who really are going to be caring caregivers. We are supporting them by helping them with their making sure they have a robust benefit package, making sure they have competitive pay, making sure we are treating them with a lot of care and a lot of respect in any areas in which they need support. And I think the more we can connect the work we're doing every day to the obviously the employee experience, employee engagement, which then directly impacts the patient experience. I think that's what keeps our team really motivated and passionate about the work they're doing.
I think that's super useful advice for everyone. I mean, the folks in your environment literally are saving lives, but even
Uh-huh.
if we in other environments are not purely saving lives in the work we do, being connected to the mission of our organizations and feeling an attachment to it as a human is one of the best ways, I think, right, to rally a team around where you're headed. So, shifting gears just a little bit here, I'd love to talk about some of the great work of your team and whatever sorts of things you're willing to share. The listeners love a good show and tell and things they can learn from. Is there something you could tell me about that you and your team have built at Stony Brook that you are genuinely proud of and would love to share with listeners?
Yeah, I would be happy to. I think one of the things I'm proudest of is the work we've done around compensation. When I arrived at Stony Brook, Carol Gomes was our chief operating officer. And shortly after my arrival, Carol was promoted to chief executive officer. And Carol literally is, and I tell her this all the time, she's a CHRO's dream CEO. So she is as committed to the employee experience and employee engagement as I am. And that alignment really makes everything possible. And Carol actually moved into her CEO position right after I got to Stony Brook. So things really align nicely. And soon after I arrived, one of the first things I started looking at was compensation because I heard about so many challenges that we were having related to compensation, turnover, vacancy, certainly the employee experience. And before Carol and I were in our positions, there really had not been a significant investment in compensation for years. I mean, employees received their contractual increases every year, but that was it. There
Hmm.
really wasn't a deep review of, are we keeping pace with the market? Are our salaries competitive? So we started looking at the competitive salaries in
Uh-huh.
the area, doing the deep dive into market surveys. And we have invested a great deal in employee compensation and have done it through meaningful market reviews to see where we needed to make changes. Obviously, no organization can fix everything at once. So we used our metrics to help inform us. We looked at where are we seeing the most turnover, where are we having the most difficult time filling positions because of salary. And we also had the commitment of our CFO, Gary B. I mean, I've worked in other organizations where we've presented this data and we hear, we get it, we understand, but unfortunately, we just can't afford to do it. I think
Hmm.
Carol and Gary were different because they really understood that we couldn't afford not to do it. And those were really some meaningful changes we made. And certainly we've done work around other things like leadership development and recognition programs and more. But I am a firm believer that pay is foundational. And if we don't have a good foundation relative to competitive pay, then we really have a hurdle that's difficult to overcome.
Oh my gosh, absolutely. And sounds like you had a lot of build out there to get that how you knew you wanted it to be. What kind of unlock is that giving you with the workforce? How is the workforce receiving that now that you've kind of done this work of benchmarking and so forth? Do the caregivers realize what great work your team has done here for them?
Yeah, I mean, honestly, I don't think it's an overstatement to say it was literally a game changer, and it has been. I mean, we've seen our vacancy rates drop from 18% to 3%, which is unheard of in healthcare. And our turnover rates have come down at their height, which was right around in the midst of COVID, about 22% down to 7%.
Wow.
And our employee engagement scores have gone from the 7th percentile to the 55th percentile. And as I said, I mean, pay is just one of the factors. We've done a lot of work around other things as well. But, I've had employees stop me in the hallway. I had an employee tell me she read the letter 3 times. She thought it was a mistake. And that when we told her, no, this is correct, this is the amount of your increase, that she literally cried. I had another employee's husband call me to thank me. So, And I've been a patient here at Stony Brook too, and I had foot surgery a few weeks ago when I'm in the outpatient surgery center, and the nurses are thanking me as I'm getting ready to go in the OR. So, it's a good feeling. It helps us understand that the work we do really does make a difference. And that, at the end of the day, there's no better feeling than that.
Those are powerful human moments, right? I have gotten a hug once for a compensation change, and it
Mhm.
reminds you that although foundational, and although we do all kinds of other great cultural work and creating meaning for our team members, and that ultimately the compensation is a big part of what people look for in terms of their own ROI for their investment of their time. And when you get a hug for a change like that, you realize the meaning that it has. So I can imagine that was like a special moment for you to be stopped in the hall like that. So what about because I want to give you a chance to talk about some of the other great work that your team is doing. What about something cultural? I know culture is really important to the work that you're doing. Is there something, some cultural program or a more cultural build out that you've done that you'd like to share with us?
Sure, we've done quite a few. I think the one that comes top of mind is probably leadership development. So we know that nothing really has a bigger impact on the employee experience, on employee retention, than the relationship the employee has with their supervisor. And it's interesting that a lot of the research tells us that as much as 80% of leaders feel as though they were not prepared to go into their leadership position, right? I call it the poof you're a leader syndrome,
Mhm.
where it's not uncommon, I think in any industry, but particularly in healthcare, to pick your star employee, maybe your most gifted RN, gifted clinician, and say, "Oh, great, you're a leader." But how we support them, how we develop them makes all the difference in the employee experience. So we've done a ton of work around really building out and delivering a very robust, interactive, hands on, applicable leadership development program. And a lot of the content of the leadership development program is around best practices in employee engagement. We've also done a lot of work around building a culture of gratitude, recognition, appreciation, really making sure that our employees understand that we appreciate and value their contributions. We do from the simplest things, like making sure we're saying please and thank you, to more formal recognition programs where we formally thank employees who have gone over and above or who model our core values. And then we have little gifts. We're a state employer, so we really have very strict guidelines we have to stay within, but little tokens of appreciation. And of course, we have a number of reward and recognition programs, as most organizations do. We have a very, very robust onboarding program. We know that those first 90 days are critical. We want employees to feel welcomed, to feel supported, and to feel as though they fit in and they belong when they arrive. So we put together a very prescriptive onboarding program that all of our leaders follow throughout the first 90 days to make sure there are lots of check-ins, lots of time to see how things are going, support employees. We put a buddy program in place so they have not only their leader, but a colleague who can just help them acclimate. And then we have a nice celebration at the end of those 90 days. So we do a lot of work in that space. We do work around resilience. That really became apparent during COVID, how important it was. We have a resilience room where employees can just go and take a breath and have a beautiful respite space. And we do some programming there too, like yoga and mindful meditation and pet therapy and things like that. But really just recognizing how important our employees are and making sure they understand that we value and appreciate them.
I love the framing of the resilience room, to be honest with you. It's so, it's sort of a unique take on what would traditionally maybe be considered like a sort of wellness space, that sort of thing. But the resilience actually recognizes the purpose of that room is
Mhm.
because the job of that worker who might use it requires resilience, and that it's not just about being well, it's about how that respite like equips them, right, to go on with their day, especially in the highly emotional environment, right, that you are in with the types of sensitive human issues, right, that your caregivers are dealing with. It's such a cool name for that, even, which feels cultural to me too.
Mhm.
That you decided to name it that. So let's really shift gears and get a little bit into AI. I'm sure you knew that some AI questions were coming. You are operating in an environment of such high trust. And there are everything from patients, nurses, physicians, staff. It is an environment where, obviously the issues you're dealing with, medical, sensitive human emotion, high trust is critical. What is your honest take? And I do really want your honest take on AI in HR right now, the real version.
Yeah, I mean, honestly, I love AI. I joke, I say I broke up with Google and I got very familiar with ChatGPT, and now recently I'm moving towards Claude, but we really utilize AI in HR, and I encourage my team to. Some of the things we do, just last week, actually, I had to do an analysis of particular policy issues and whether or not which of our policies covered a particular pain point for us and where there were gaps. Probably had about 8 different policies that touched upon this particular topic. And, my initial reaction was, ugh, this is the really not so fun part of HR and the tedious part of HR. But I was able to, without any identifying information, paste the policy content of all these different policies into AI, and it built me the most beautiful table comparing all of the different policies, which ones spoke to the language I was looking for, which ones spoke to it marginally, and which ones had a complete gap. I mean, it did in 20 minutes what would have taken me a whole day to do. And now, of course, after we do that, we look at it, we review it, we validate it, and so forth. But it takes some of that tedious, heavy lifting off our plates. And we've used it to draft preliminary job descriptions, even to do some first level compensation reviews, all types of things. But I think the big message for me and my team, which we talk about all the time, is no, it is not going to replace the work we're doing, but it's going to take the really tedious, time consuming, labor intensive, routine tasks and make them simpler. And then our job becomes doing that higher level work of reviewing it, doing the deep analysis, and synthesizing and communicating our recommendation at the end of the day.
Yeah, and in the high stakes, like the high stakes human impacts that exist in your environment, more time to spend on those moments of empathy and moments in human interaction with folks. So yes, love that you're getting rid of the tedium with AI. What about with respect to the broader workforce? Just one thing I haven't talked about with any guest in working in the healthcare space is how they are thinking about AI implementation. Not, and I don't need you to get real specific. I'm talking more about the human behavior changes. You're dealing with a workforce that's been largely engaged in and focused on human care, right, throughout their career. Are you seeing a high appetite? Are you seeing some skepticism from caregivers in terms of AI and their workflows? And how are you helping them through some of these changes?
Yeah, well, and the thing that jumps out at me right off the top of my head is the scribes, the AI scribes that are used
Hmm.
by providers. So where they used to have to take detailed notes as they're trying to talk to the patient at the same time, now they can have an AI scribe in the background taking those notes for them, and the providers are having a much more meaningful experience with the patient. And then, of course, they have to go and look at the notes and validate the notes and make any changes to them. But I think there is a big appetite for it. So much of nursing care and nursing work is paperwork driven, and that is exactly what our clinicians don't want to be tied up with. They want to be at the bedside, they want to be with the patients, they want to be influencing care outcomes and the patient experience. So again, I think AI gives us an opportunity to take some of that off their plates, recognizing that you're always going to have that human review and that human intervention at the end of the day.
Yeah, the improved listening that is happening when a conversation can be transcribed is massive, right? And it applies like in the caregiver situation, but I know in the workplace that I'm in meetings, in interviews, that kind of thing as well. Like the quality of our listening when we're not also needing to take our own manual notes
Mhm.
is a massive unlock that I think is, not as widely understood, right, as it really is. I think that's, like, a huge area of opportunity. I'm putting my bet on that being, like, the next push, that folks get a lot more comfortable with, in the next 6 to 12 months for sure. I'd love to get into a little bit more of a philosophical conversation opportunity for you to share advice with peers. So, if you could sit down with one of the HR leaders that's maybe listening to our chat right now, what is the conversation that you would want to have? Maybe something that HR leaders are not talking about enough, but really should be.
There's so many, but one that jumps out at me philosophically, I mean, there are probably a couple that jump out at me philosophically. One is to really move away from the mindset, and this is not typically an HR mindset, but it may be an organizational mindset. So to help the organization move away from the mindset of defining job requirements so narrowly. So typically when we're hiring, we'll see a lot of job descriptions that talk about you have to have done this exact job or you have to have worked in this exact field in order to qualify for that job. But so many skills are transferable and the things that are, and we could teach skills, we can help people gain experience, but it's really, really difficult to teach things like aptitude, curiosity, drive, work ethic, values. So the more we can hire for those things and then teach and train skills, the better our workforce will be as a result, and the better we'll be able to meet our organizational goals as a result. We talk a lot about culture, and I think the flip side of that is when we don't hire the right people in terms, particularly in terms of values and behavior, that in and of itself can have a significant impact on our culture. And then we get to the harder piece of it, which is now addressing that behavior. And I guess that's the other piece from a philosophical point that sticks with me is I see so many leaders struggle more than anything with addressing behavioral issues. And I think they get stuck because I hear a lot the toxic employee or the negative attitude. And I always say we're we're setting ourselves up for failure as soon as we start talking in those terms because we can't evaluate attitude. I mean, that's internal, right? But what we should be focused on and evaluating is behavior. But it's interesting because I think many of us were never taught how to pinpoint the specific behaviors that are problematic, that are making us conclude that somebody has a negative attitude. And I first learned that term about pinpointing behavior a few years ago when I worked in a residential and educational facility for kids and adults with intellectual disabilities.
Okay.
And we had behavioral health who worked directly with the kids and the adults. And the clinical skill was to do exactly that, was to identify what is actually being done or said that is problematic or not done or not said. And it could even be nonverbal. And the more we're able to pinpoint and talk about a behavior, the more we're able to help coach and ultimately change that behavior. If we tell somebody you have a negative attitude, we can guarantee we're going to get defensiveness and resentment. and things are not going to get better and maybe they're going to get worse. But if instead we say, in today's meeting, I noticed that you interrupted Sam 3 times when she was trying to talk. Let's talk about that. Let's talk about how that may impact what you're trying to achieve. And we go from there. The employee is going to be much, much more willing to engage and understand that we're trying to help them improve and succeed than if we label the employee. I say, take adjectives out of your vocabulary and replace them with verbs. Don't label the person, talk about the behavior.
That's a great tip. I'm curious if you have any other tips if when a leader shows up to your office and is talking about attitude versus behavior, and clearly they're not doing that, pinpointing the behavior. Are there any tricks that you can offer them to reframe them to get them to go see a behavior versus an attitude?
Yeah, we actually do this exact exercise in our leadership development programs. I tell them, think about the person either at work or in your life that when they walk into the room or they call you on the phone, you just sigh, you take a deep breath, and you think, oh, no, here we go. And I say, now think about what is it exactly that they're saying or doing. And sometimes they struggle with that. Even when you prompt them, they struggle with it. But we give them some prompts. Is it Are they speaking in a tone that you feel is condescending? Are they not willing to engage in problem solving? Are they raising their voice? Are they rolling their eyes? And we just try to give them some prompts, and that can get the conversation started. So maybe they'll say, well, no, not exactly that, but it's kind of more like this. And we just keep kind of teasing it out until we're able to really help them pinpoint those specific behaviors.
That is a great tip. So I could dive in deeply here, but I am going to take us to our lightning round because the time has flown by. These are just some quick hit questions to get some of your great advice and out to our audience. So, what is one AI tool that every HR leader should have in their toolbox and be using right now, in your opinion?
Well, definitely either ChatGPT or Claude. And if you're writing job descriptions, I would absolutely say, hey, here's what I need. I wrote one 2 weeks ago for a CMO position out at, or maybe it was longer than that, but for a CMO position out in one of our East End hospitals. And, I'm not a clinician, but I was able to say, here's what I want. Here are some of the things I know I need included. Draft it for me. It did. I had a beautiful document as a starting point, and it saved us so much time and energy. If there's anything where you have to do a comparison of different, as I said, different policies, different job descriptions, talk about which one is more complex, which one is higher level, leverage AI to do that for you. Certainly, if you're writing emails or anything that's sensitive, again, taking out the identifying information, but have it evaluate the tone for you. It's endless what it can
Game
do and
changer.
how it can help us.
Totally. What is a myth that you think is kicking around out there about AI in HR? Like something that people keep saying, but you just don't believe is actually true?
Well, I think the biggest myth is that it's going to take our jobs away and that we're not going to need HR anymore and that AI is going to do everything we can do. And I honestly don't see that happening. And, I've lived through lots of different technological changes throughout my career. There's always that hesitancy, there's always that anxiety around change, but at the end of the day, it still is a human experience, and at the end of the day, there are always going to be things that humans can do that AI can't, and we are going to be involved in more of the strategy, involved in more of the human touch and those real conversations that need to happen that AI won't be able to do. But I do believe that our jobs, I mean, I've already seen it just in the, I don't know. I wish I could remember when I first met ChatGPT,
Yeah.
whatever that special day was, but whether it's a year or 18 months, I mean, I honestly don't remember, but it's it's just made my job so much more enjoyable. And I always loved HR and what I did, but there were certain aspects of it that are tedious. And
Mhm.
now to have those tedious pieces, get the help with that heavy lifting, and focus on the things that are meaningful to the organization and that we really enjoy doing makes such a difference.
Totally going to change our worlds, and it already has in so many companies. So I'm going to give you an opportunity to give a shout out here on this last lightning round question. What's the best piece of advice that you've ever received about leading people, and who gave it to you?
It's interesting because I talked a little bit about, my philosophy that we really have to talk about behaviors and not label people. And I still remember it wasn't a particular person, but I remember vividly the training session, and it was conducted by our director of training 100 years ago, whose name is Vince Mazzella, and who was a wonderful director of training, just a wonderful person. But he used the Zenger Miller leadership model, and I don't even know if it still exists. But there were two things that were said. There were I think 3 or 4 principles, but the 2 that stuck with me and really have influenced me throughout my career have been focus on the behavior and not the person, and always maintain the dignity and self-esteem of others. And those have really stuck with me, and I've tried to impart them on leaders, that we don't criticize the person, we talk about the behavior, or we talk about the performance, and we talk about the expectations, and we always treat people with dignity and respect. And I'm sure, like me, many other of my HR peers have had to have difficult conversations, have had to participate in meetings even when we're ending the employment relationship. But even in those circumstances, we can do it in a respectful, kind, and compassionate way. So those are some of the lessons that really stay with me, and that I think I'm most committed to, is really creating a fair, compassionate, and accountable culture. Because part of compassion is making sure that we don't tolerate behaviors that are disrespectful to others. So that
Mhm.
accountability piece has to be part of it. But I think a lot of people think that compassion and accountability are mutually exclusive, and they're
Right.
absolutely not.
They absolutely are not. Well, thank you. That's great advice, and I can see why that stuck with you. So I don't know if you caught me frantically writing as you were talking, but I always try to get a few takeaways from guests as we go through. So we'll see how I did here. I think whether my first takeaway is whether you are literally saving lives, as many on your team are doing, that piece doesn't matter. The thing that is critical is to get your team clear on the mission, saving lives or otherwise, and connect your team to it. You're doing that with your HR team. You're doing that with clinicians. We can all take that away and do that in our environments as well. I loved the when you talked about leadership development and the importance of of not succumbing to the poof, you're a leader syndrome, which we've all experienced. That your team has taken some really strong accountability. It sounds like in making sure that when someone is poof, they're a leader, that how do you make sure to offer the right programming to make them a wonderful and supportive leader in your environment, and calling out the thing that we've all heard. No one has a bigger impact on the team member's experience than the relationship that they have with their leader. And it sounds like your team's taking that very seriously to make sure that that is a great relationship
Mhm.
that folks are having at Stony Brook. And then the last thing I'm going back to is the pinpoint behavior. So I love to remove the adjective and replace it with a verb, and really catching the tip of catching something that they are saying or doing, right? You feel the feeling that you're having in reaction to a person, but what you actually need to do to get to the feedback is observe something they are saying or doing that you are seeing or hearing, so that you're addressing the behavior and not attacking the person in clearing that up. So loved all of those, and you get the last word because the guest always gets the last word. So, Colette, what's something that you want an HR leader who is listening to us today to think about and possibly consider doing differently tomorrow?
I think it's basically to invest in yourselves and to think about where you want to be in your career and how do you get there, and taking time out. whether it's blocking an hour on your calendar or a couple hours on your calendar to think about that. Have AI help you build a plan. Tell it what you want to accomplish and a little bit about yourself, and it will literally give you a plan of the steps to get there. And then I think, as HR professionals, we really do. We take care of all of our employees, and we hear from HR professionals, well, who takes care of us? So, I think this is one of the ways that we can take care of ourselves is really taking time to think about what we want to do and where we want to be, and then developing a plan to get there.
Well, I feel like your wonderful environment at Stony Brook has rubbed off on you in that advice. So, how appropriate for you to have reminded all of us to take care of ourselves so that we can take care of everyone else. So, thank you for that. I think that is great advice. I'm so glad to have had you on the show. And thanks for joining me, Colette. This was awesome.
Thank you, Barbara. It was my pleasure, and I really appreciate the opportunity. And so nice chatting with you.
Of course.